Welcome, everyone. I'm Bob Golden, the Dean of the UW School of Medicine and Public Health. Before we get started, I want to acknowledge that our university sits on the lands of the Ho-Chunk Nation. This evening, we are discussing the very important topic of disability rights. You know, approximately 28% of adults in the United States live with physical disabilities, and about 12% have a communication disability. A disability can impact the health of an individual and also their access to health care. These factors contribute to disparities in this very important and vulnerable population. The School of Medicine and Public Health is committed to supporting those with disabilities. It's essential for all clinicians to learn about the broad range of disabilities individuals experience and how to provide personalized care for someone with a disability. But you know, that's only one side of the proverbial coin. We must include individuals with disabilities in our commitment to develop a clinical workforce and our SMPH community that is diverse and inclusive. We must actively strive to create a community of learners and teachers that fully embraces people living with disabilities. We should actively recruit and support them. In return, their strengths, talents, and abilities will add to everyone's experience, making all of us more complete as clinicians and adding to our comprehensive service mission. I want to thank our two speakers this evening, Judith Heumann and Kristen Joiner, and our moderator, Bill Schwab. Thanks also to the individuals in the Path of Distinction in Public Health, and especially John Tempte, who organized this event. And a very special thanks to Tracy Gatos and all the others behind the scenes. I am relatively less anxious knowing that they will prevent me from experiencing as much as possible yet another "you're on mute" situation. So assuming that I haven't been on mute, it's now a pleasure to turn it over to John Tempte.
Well, thank you so much, Bob. Dean Golden, it is wonderful to be part of this tonight. At the School of Medicine and Public Health, we are committed to the well-being and health of all individuals, communities, and the public at large. In this spirit, our Hot Topics in Public Health takes on those cross-cutting issues from COVID-19 to climate change, things that have wide-ranging effects. Well, tonight we have partnered with our Pathway of Distinction in Public Health with support from the Wisconsin Partnership Program to bring you a conversation on disability rights. We are incredibly honored to have with us a wonderful crew. First and foremost, Kate Block and Scotty Allen are serving as our American Sign Language interpreters, and we are very grateful. Judy Heumann is a lifelong advocate for the rights of disabled people. She has been instrumental in the development and implementation of wide-ranging legislation such as the Americans with Disabilities Act and the UN Convention on the Rights of Persons with Disabilities. Her memoir, Being Human, an Unrepentant Memoir of a Disability Rights Activist, was co-authored by Kristen Joiner and was published in 2020. She is also featured in the Oscar-nominated documentary Crip Camp, A Disability Revolution. Judy produces a podcast called The Human Perspective, which features a variety of members from the disability community. She serves on a number of nonprofit boards, including the American Association of People with Disabilities, the Disabilities Rights Education and Defense Fund, Humanity and Inclusion, and Human Rights Watch. Welcome. Kristen Joiner graduated from the University of Wisconsin with her BA in contemporary art, comparative literature, and set out to change the world. After working as a community organizer on the US-Mexican border, doing HIV policy program management with the Senegalese and Ghanaian parliaments, and co-founding a green school here in Madison, Wisconsin, her hometown, she started writing. In 2015, her agent introduced her to Judy Heumann, who let Kristen co-write her book, even though Kristen had never really understood disability rights. Determined, though, to understand the world through Judy's eyes, she co-wrote her memoir and the young adult version, Rolling Warrior, the incredible, sometimes awkward, true story of a rebel girl on wheels. Our moderator this evening is Dr. Bill Schwab. Bill Schwab is a colleague and a mentor of mine, a professor and the vice chair in the Department of Family Medicine and Community Health. A native of Madison, Wisconsin, Bill found himself working as a family physician at a community health center in the coal fields of southern West Virginia, returning to join our faculty in 1985. Bill is nationally recognized as a leader in patient and family-centered care, as well as in medical education about the care of children and adults with chronic illness and disabilities. He has been the recipient of the Humanism in Medicine Award from the Society of Teachers of Family Medicine, along with the Arnold P. Gold Foundation. Bill is committed to partnerships with patients, with families, and with communities to assure welcoming healthcare for all. I turn the evening over to you with my gratitude. Thank you so much.
Well, thank you, John. Appreciate the kind introduction. And also thank you to the many members of the planning group who organized this session and to our ASL interpreters. I'm pleased to serve as the moderator from my perspective as a family physician who focuses on the care of people with disabilities, as someone who has been involved in advocating for disability rights, and as someone who has lived experience as the parent of a child with severe disabilities. The format for the next 45 minutes or so was described during the planning as a fireside chat with Judy Heumann and Kristen Joiner, which seems like an apt metaphor for this hot topics in public health session. Now, because we're doing this by video streaming, and you should know that we're seeing Judy from Washington, D.C. and Kristen from New Zealand. Because we're doing this by video streaming, though, you have to bring your own fire to this chat. Judy Heumann has brought fire and heat to issues of disability rights for over 50 years. And Kristen Joiner has added great light in co-authoring with Judy the book, Being Human, here it is, an unrepentant memoir of a disability rights activist. And we're not hawking books here, by the way, but it's really great. As well as the companion book for young readers, I got that one here too, Rolling Warrior, the incredible, sometimes awkward, true story of a rebel girl on wheels who helped spark a revolution. Sparked a revolution. There's our fire metaphor again. So a warm welcome to Judy and Kristen. Thanks so much for joining us. And they're going to each say hello for a brief moment here before we really launch into our conversation. Judy?
Hi, thank you so much, Bill. My name is Judy Yan. I had polio in 1947. I'm 74, probably one of the older people on the Zoom call tonight. I use a motorized wheelchair for people who can't see the screen. I'm wearing red glasses. I have brown hair down to my shoulders. I'm wearing dangling earrings. I have on a pink sweater, and we're in the foyer of my husband and my apartment. And we have drawings and artwork and family photos and postcards on the walls and plants in the background. Let me say that, it's always difficult to put together one's bio. But for the sake of this discussion, I also have my master's in public health from Berkeley. And it was in the 1970s when after I had filed a lawsuit against the Board of Education because they denied me my teaching license, specifically in writing because of paralysis of both lower extremities, sequelae of poliomyelitis, that I sued the Board of Ed and was able to ultimately get my license. I needed to get a master's degree. I was originally going to go to Columbia, and then I was recruited to come out to Berkeley to work with an organization called the Center for Independent Living, of which there are probably about 700 in the US today, but it was the first program. And also to become a graduate student at Berkeley School of Public Health. What was interesting about that experience is there was a professor, Henrik Blum, who I admired deeply, who was interested in looking to bring a few more disabled students into the School of Public Health because there weren't really people there at that point who were identifying as having disabilities. And public health for me really legitimized the work that I was doing because I look at the lives of disabled people, not exclusively disabled people, but in general, and try to look at the disparities that exist. And it's not needing to deal with one disparity against others. It's really needing to deal with the entire system. And in the case of disabled people, depending on the type of disability, the failure of multiple systems is something that, in my view, people in the healthcare, public health, medical field need to be doing a lot more on in order to really serve your clients, your patients, whatever you ultimately call them. And while I feel there are some positive changes that have gone on, obviously, over the course of my life, I actually do not feel that the healthcare profession, broadly speaking, has really done justice to what it could be doing to help break down barriers that have been excluding disabled individuals from appropriate education, early childhood, primary, secondary, higher education, and also recruiting people who have qualifications to work in various healthcare fields. UCLA, where I recently lectured, has a program where they are specifically looking at the biases in recruiting disabled people into the field of nursing. And I know there's work going on where you are, where you have some healthcare providers, disabled doctors and nurses that are looking at some of these issues. But if this is a sincere discussion, then I think we really need to look at the roots of the failure of adequately bringing in disabled people into the various professions. And equally importantly, we need to understand how the failure of bringing disabled people with different disabilities into the professions ultimately provides a poorer quality of service for our clients, patients, people.
Thank you, Judy. Kristen, special welcome to you back here to Madison. It's a lovely day here today. And, you know, I'm sure you get to experience some of those when you come back to visit. But please say hi.
Thank you so much. I'm so excited to be speaking at, you know, my alma mater at UW in my hometown, Madison. I wish I was actually there. For those of you who can't see me, I'm wearing a dark sweater. I have long shoulder-length blonde hair. I'm actually joining you from Wellington, New Zealand today, where it's a beautiful sunny day. I am always privileged. One last thing. I wanted to say thank you to my sister who was the spark, going back to the fire metaphor, who created the fire of this conversation, Nancy Krull, who's a part of the public health program at UW. I'm always privileged. I was really privileged to work with Judy on writing her memoir, both of her memoirs. And then I'm always privileged to be sitting next to her in these conversations. And one of the things I wanted to say is that I worked for 20 years in human rights and feminism before I started writing. And when my agent brought Judy's project to me and asked me if I wanted to do it, I realized that despite my experience in human rights and civil rights and feminism around the world, I had never really understood disability as a rights issue. In our field, we gave it lip service. We always said that we worked for intersectionality. We worked on race, gender, class, disability, but disability always got lip service. And so when Judy and I started working together, that was one of the primary motivations for me, was to really understand why that was the case. And one of the things that I really came to understand is that one of the reasons why that was the case was because disability has always been medicalized through society. The perspective of the people working in rights, like me, and human rights and feminism, saw disability as a medical issue, not a rights issue. And when I learned from Judy and her story was that one of Judy's Judy has many brilliant things that she's done in her past, but one of the things that she did that was really pioneering was flipping the script and saying disability is not a medical issue, it's an issue of rights. It's an issue of how we design our society. And that was the kind of root of her activism and leadership. And so for me, it was a journey of understanding how we who may not be disabled see people with disabilities, although, disability is the category where any of us could join at any moment. So I'm really pleased to be here. Thank you. I just wanted to add a little bit of color to the journey that I've been on.
Thank you for that. Well, we're going to launch into our conversation. For those who are a part of this presentation, please know that we have a chat function there that is going to be monitored by one of the members of our committee who will be putting together questions that are related or maybe bringing them up. And after about 45 minutes or so, maybe around 6:30-ish, we'll transition from our conversation to another half hour where we'll take the questions that have been both pre-submitted in advance of this session and during this session. So please feel free to make your comments with that. You'll also notice that our ASL interpreters will periodically switch their roles. Well, to both Judy and Kristen, 1 week from today, April 28th, will mark 45 years since the signing of Section 504 of the Rehabilitation Act that for the first time mandated equity of access to public accommodations for people with disabilities. The intense advocacy by people with disabilities that Judy led in 1977, you can read about her book, you can see it in the great film Crip Camp, and I encourage you to see that. That advocacy, including the takeover of a government building for over 3 weeks and many other creative actions, was a seminal moment for the disability rights movement. Since then, Judy has had major leadership roles outside and inside of government, as well as internationally, as John outlined. I'm curious, from the perspectives that you both bring to this, what does this 45-year arc of history tell us about where we've been and where we need to go in assuring equity and full inclusion for people with disabilities?
So let me please begin by also explaining that Section 504 did way more than address the issue of accommodations, and both its breadth and its narrowness. So Section 504 only covers entities that are recipients of federal financial assistance. And for those institutions, it basically covers both the physical environment, employment, universities and their obligations to not discriminate in the recruitment of disabled individuals, faculty, and staff. And basically, that law has been in place since 1973, although the regulations didn't come into being until 1977. I think one of the important issues to also look at is, in my view, how universities have not in 50 years, 45 years, but how many, it's really almost 49 years now, have still not lived up to their legal obligation both in the area of physical accessibility, but I think more broadly than that, in addressing issues as you've discussed a little, and other speakers already have mentioned, issues of ensuring that disabled individuals are being brought into the careers and professions and are receiving appropriate supports they need. So I would say that Section 504, which was the precursor to the Americans with Disabilities Act, and ADA covers the public and private sector, was clearly critically important for many reasons. I would say one of the very important reasons is because it was one of the critical pieces of legislation that began to bring disabled people together in more of a cross-disability movement. Previously, and certainly still today, but not to the same extent, people were really, as Kristen was discussing, looking at disability as a medical issue. And so there were and are these stovepipes which deal with whatever the particular label of a disability was and is. When you look at Crip Camp and when you read these books, one thing that I believe you begin to learn about is how disabled people, both veterans after the Second World War, of whom there were more because they were surviving because of penicillin, and also because of the Civil Rights Act, the Civil Rights movement itself, and how the disability movement and other movements were learning from the Civil Rights movement. And the disability community really beginning to recognize that we were not alone. And by that I mean, you know, each individual person needed to be looking at peers, colleagues, and others who were experiencing similar forms of discrimination. And I think you see this really clearly in our books and in the film in many other ways, that we as disabled people began to emulate what others were doing and began to really look at moving away from complaining about the injustices and discrimination, and really began to think about what it was that we needed to do to break down barriers. In the area of disability, I think, unlike some other communities, the kinds of discrimination that we experience are the same and different. Different in as much as when you think of Rosa Parks and her refusal to move from the front of the bus to the back of the bus, she was able to get on the bus. If Rosa Parks was a wheelchair user, she never would have been able to do that because she couldn't have gotten on the bus. So a lot of what the community has had to do is really not only to define what the specifics of the barriers are, but we've had to be able to work with others, many of whom knew more than we did, like engineering of a bus. Like that certainly was not my area of expertise, nor many of my friends, but we knew that it was something that was not going to be impossible, because many of us were coming to school every day on accessible school buses, but we weren't seeing those buses replicated like on the streets of New York or wherever you were living. So what I believe has been really important over these decades is the growing numbers of disabled individuals who are recognizing that in order for us to really be able to have a strong impact, we have to be able to be unified in discussing what discrimination is, what the remedies are, and really being much more unified and strong at the federal, state, local levels, and private industry and public industry to really fight and to fight against prejudice, fight against discrimination. And that ultimately means the need to change systems that have not been appropriately doing their jobs, such as in the area of education, primary all the way up.
Thanks. Kristen, thoughts?
Yeah, I think that one of the things that really struck me when Judy and I were working together was how invisible discrimination is against people with disabilities. There were no signs on the bus saying no people with disabilities, right? Where they were saying no people of a certain race, or that is very clear, blatant discrimination. But with people with disabilities, it was just designed into the system. It was invisible. There were no signs. And so I think that makes, so what happened was there was sort of this catch-22 where people with disabilities were saying, we're not allowed access, but everybody was saying, but nobody's saying that you're not allowed access. We're just designing in all of these small ways a society that doesn't allow access. And I think
you get on the bus, we'll let you on.
Yeah. And I think that's one of the really big struggles for society in the end, this movement. And I also think as a result that the other thing is that often people acquire disabilities at different ages as a result of various medical issues. And that's because of the invisibility of the lack of access and the invisibility of discrimination, it ends up being very isolating and disorienting, that process of going from being maybe non-disabled to being disabled, and then not knowing where to go next. And then how do you build, how do we kind of handle this group of people that grows? And so I sort of came to the conclusion when Judy and I were working together, that it's really a human issue, that if we just say we're all human and one day we could all become disabled, and we'll just design society that way, then that we wouldn't have to think differently about disability. It would just be part of being human.
And that,
no pun intended.
No pun intended, I'm sure. But yeah, universal design is what could, should, and must anchor our society.
If I could, just for a minute.
Yeah.
I think it's important in this discussion that we also broaden and make clear who we're speaking about regarding disability. So we're talking about people with all kinds of physical disabilities, with all kinds of sensory disabilities, deafness, hard of hearing, blindness, low vision. But we're also talking about people with invisible disabilities. So people with autism, intellectual and developmental disabilities, but people with depression, anxiety, bipolar, cancer, on and on and on and on. And the reason why I think it's important for a minute to really reflect on the population is because the discrimination that we've been discussing in many ways has made people who have invisible disabilities embarrassed, fearful of discussing their disabilities because of the stigma around disability. Sometimes people will say, well, my disability isn't as much as your disability. But really, I think it's ultimately, in most cases, it's the stigma. But on the other hand, when people are not feeling comfortable in their own bodies to be able to discuss who they are, including their visible or invisible disabilities, it ultimately also means that they are frequently not getting the support services that they need, which also may include basic health care. So in really breaking down the barriers as broadly as we would like, in part, it is really to enable people to be able to speak up and out about their disabilities. I think COVID as a perfect example, people who have had COVID, some of those individuals, like people who had polio, may not be feeling the effects of COVID for many years, or it may be getting more significant years down the road, we don't know. And when we talk about issues like causes of disability, and we look at the environment, and we look at pollution, on, we see an increasing number of people with respiratory conditions and other conditions, not even to speak about famine and refugees and the disabilities that are caused as a result of that. So for me, one of the imperatives of public health field really owning the issue of disability in a more forthright way is not only to address the issue of prevention, but is very much to be able to look at what needs to be happening to ensure that people who have disabilities will be acquiring disabilities have access to health care, mental health services, but also to the broader systems that we value in this country and around the world, like education and employment, transportation, housing, benefits, food, on and on.
Great. You know, in the book, you very candidly shared Judy's childhood experience of developing awareness of how others perceived her and how her own self-identity evolved. And we've been getting at this a bit. Perceptions and attitudes at a much larger scale impact policy and impact legislation, as well as the understanding of disability by employers and educators and healthcare clinicians and neighbors and communities. And I was really struck by a particular point made in the book which says, quote, people with disabilities have to work to overcome the feeling that asking for equal opportunity is asking too much. The feeling that asking for equal opportunity is asking too much. Can you each expand on your sense of how people with disabilities are perceived in our country and beyond in other countries? You've had lots of international work, and what the implications of those perceptions are.
You want to go first?
Sure. Or you go first.
No, you go first.
Okay. I think that what I understood about this when Judy and I were working together, and we talked a lot about this issue in various ways, is that when you have a society that's not accessible. So, for example, when Judy was a child and she was growing up in a society that wasn't accessible, her daily life and participation in society was dependent on favors. So she, for example, if she wanted to participate in religious, which she was participating in Hebrew school or a summer camp, and all of the kids went down into the basement or into a lower level or an upper level to do an activity, her mother had to ask the instructor for help. Can you carry Judy up or down the stairs? Because there was no other, right? So, and I think that if you take that one small moment of her just wanting to be like all the other kids and be treated like all the other kids, so much of her, and you multiply that exponentially. We haven't designed into society in every single way for children and adults with disabilities to just be accommodated, and so therefore, yeah, they're dependent on favors, and so everything they're asked, when they ask for it, it seems like a burden, and that becomes internalized in both the minds of the families and of the people themselves. And I think, yeah, I mean, Judy, I mean, that would be one of the very first things I would say. And then we as a society, just going back to the narrative, the very first narrative that we got exposed to in many ways is pity for people who are non-disabled, have pity for people who have some type of disability. And that stems back to the telethons where people were raising money for people with muscular dystrophy. And, and so that also shapes how we see disability. So it all sort of adds up to be one where we don't see it as part of society, and therefore it becomes extra, and therefore it becomes a lot of work, and it's a burden and a favor.
I think one of the problems is we don't see disabled people. I mean, I'll start with the media, but all too frequently, disabled people are not a part of the various components of media, and when disability is a part of it, it's changing a little bit, but their negative representation, looking at the disabled person as a tragic figure. If you look at, I'm thinking of the movie Johnny Belinda. The woman who played Johnny Belinda was not deaf, and that's another very big issue of characters with disabilities too frequently not being played by disabled people. Therefore, saying that there aren't qualified disabled people to play those roles, which is clearly not true any longer. But additionally, the lack of visibility and misrepresentation and looking at cure, which is a big thing, or suicide. The person who becomes disabled, valuing their life, not at all feeling like, as Kristen was talking about, being a burden on society and choosing to kill themselves. Now, suicide is an unfortunate reality. So if there were other representations of disabled people, someone once in a while committing suicide, if it's a true story, that's a true story. But in fact, because there is such little appropriate representation and an increasing movement demanding that disabled people be a part of behind and in front of the screen, those things will slowly begin to change people's views towards disabled people, because they'll see, and one of the complex issues in disability is we're not all born with our disabilities, and as we've discussed, we all don't have visible disabilities. So the need to be able to articulate some of the issues that disabled people face, which certainly can be done in an appropriate way, is something that we need to be doing. But until we can really break down more of these barriers and get true representation of disabled individuals, we still have, I deal with it on a day-to-day basis. So I use personal assistants, people to help me get up in the morning, go to bed at night. And I find it really interesting. I've been having difficulty finding people to fill the jobs that I need. This is, like, I think, going on all over the country and the world. So I've been having numbers of people who are working different times. And in the last 2 days, I've had 2 different people who've worked with me in the morning. Now, when they come to my house, I'm giving them all of the directions about what needs to be done. I have my own company and 2 people who work. They come to work at 9 o'clock. And so yesterday and today, one of the people was here in the office, dining room, and I asked them to come in and help the person look at how to unplug my wheelchair and push it in to the room and help me with something else. As soon as there was another person there, these people deviated from me and started asking this other person, what does she want to wear as a blouse? And I'm like, ask me. But I find it so very interesting that they were dealing with me in the very beginning because nobody else was here. But as soon as there was someone else there, they gravitated towards asking somebody else what I needed. And I think it's those things that happen all the time. I go to the airport, the person at the desk speaks to the people that are working for me and traveling with me, saying, what does she need? Now, I don't have an intellectual disability. I'm clearly able to articulate what I need, but those things get manifested regardless of the type of disability a person has. And this assumption that regardless of the disability, someone is not able to answer a question, to give direction and guidance about what they want, is, I believe, because of this insidious history of believing that we cannot speak for ourselves.
Thank you for that. And, it leads us to talking about one of the central tenets of your advocacy. Judy, you've been a powerful voice for a cross-disability perspective, and you've been incredibly effective at building alliances among people with a range of conditions. Within those coalitions, there's a central understanding of commonalities within the experience of people with disabilities, who, depending on the definition, can encompass over 50 million people in this country. It's notable, though, that HRSA, the Federal Health Resources and Services Administration, has declined to identify people with disabilities as a medically underserved population, and that the Federal National Institute of Minority Health and Health Disparities similarly does not include people with disabilities as a health disparity population. And I'm just curious, you don't need to know, of course, all the details of the federal policy, but I'm wondering from your perspectives, are people with disabilities underserved? And do they deal with health disparities? And then how does this relate, when we think about this, to broader conversations about diversity and disparity in our society that do tend to be focused more on people who directly deal with racism and other forms of structural discrimination? So big question. Go ahead.
The Lancet had a piece in June of 2021, Disability, a Neglected Issue in Public Health. It's a paper that I think people should read. It goes without saying that disability is something that is not, as we've been discussing, appropriately identified. And again, if we look at things like COVID, and we look at what 250,000 disabled people who died in nursing homes and segregated congregate living programs with various forms of disabilities, we can see that the biases and lack of appropriate community-based services put disabled people at greater risk, including healthcare risks, and that the system has really not addressed these issues from a health perspective. Now, I find it, and I was mentioning to Bill earlier, I haven't seen this data, but I'm sure he's correct. But when you look at as when COVID was advancing and we were hearing things like poverty and linked to diabetes and hypertension, and also Black and Brown individuals were one of the leading causes of death. If you brought those different components to the table, there were higher incidence rates of people dying. Now, partly it was because they weren't getting appropriate health care all along. So their quality of health was inferior. And so they were vulnerable to COVID and other diseases. So the answer is, absolutely. And why disability as a topic is not included, I don't know, but it's certainly something that happens over and over again. In this regard, Bill, it's like obvious, how could disability not be included? But then if you think about like voting, there's been a lot of work that disability groups have been doing on the right to vote for all people, including disabled people. Disability rights organizations that have been very much on the front lines working to support the John Lewis legislation or other similar legislation at the federal level, fighting at state levels against repressive laws that governments are passing, because it will have an adverse effect on minorities, including minorities with disabilities. And yet, when you listen to the reports that people are giving, for example, on who will adversely be affected by these voting laws, the word disabled people is hardly ever mentioned. So I think we're still, unfortunately, very much dealing incrementally as the disability movement increases, and quite frankly, as people like yourself and the university begin to ask these questions and get involved in these dialogues. That's why I think the Lancet paper is really very important. People who are working with people in these government agencies need to be pushing that these reforms occur. And when they're not, at the very minimum, knowing there was a discussion and understanding what they're saying regarding why it's not being included is very important, because that'll also allow people to come back and look at how this needs to be done. Because data on collection, data and disability has been something that has woefully been neglected, and it has been improving in certain areas, like in education for disabled children. I would say that the federal government, through the Department of Education, for many decades has been improving data they've been collecting. But we know that data on disability was not collected as it should have been in many different critical data collection tools. And slowly it's changing. Like the Department of Labor until 2008 was not collecting unemployment data in the area of disability, but now it is collecting unemployment data for disabled, unemployment and employment data for disabled people. And that's really important, because it allows us to look at moving away from anecdotes, which is what disabled people and professionals in the field were saying, that there are higher rates of unemployment for disabled people, even those who meet the qualifications clearly. And data from the Department of Labor really is substantiating much of that and allowing us to look at what needs to be done to correct those issues.
Thanks. Kristen, and particularly those thoughts about how we place this conversation in discussing diversity and disparity in the context of racism and other structural discrimination.
It should be right in the center. I mean, in my view, disabled people are Black and brown and on and on and on. If disability, Black disabled individuals, brown disabled individuals, on and on, are not included in those discussions, it really perpetuates the biases. Since, as we know, the incidence rate in certain communities, because of healthcare disparities, does adversely affect people with disabilities. But equally important, we need to be looking at issues that we've just been discussing too. When we look at the disparities in education, as an example, and we look at the number of people, juveniles, in juvenile facilities, 50 to 80% of that population have various disabilities: mental health, mild to moderate intellectual disabilities, physical disabilities. If the education system is not being held accountable to ensure that these students are being appropriately identified and appropriately served, not pulled out and placed in segregated programs that are not teaching children as they should be taught, and kids subsequently dropping out of school, they've got to be held accountable. And these are issues that not just the broad disability community, but other movements need, in my view, to really be owning, and owning that disability is a part of all the different communities.
Excellent. Kristen?
I would just add, I don't have a lot to add to, I feel like Judy has really covered this so comprehensively, but I would just add that, we allow for assumptions. There's a lot, with discrimination creates erroneous assumptions and myths and stereotypes. And one of my favorite examples from what happened after the Section 504 sit-in is that they signed the regulations, and then the bus system, or the public transportation system, said it's going to be way too expensive to make the buses accessible. And then a coalition of the people with disabilities that had come together after 504 did the actual research to find out how much it was actually going to cost to make the buses accessible. And it turned out it was going to be like the cost of putting in an air conditioner, because the public transportation system had neglected to take into account the fact that if they make the buses accessible, there'll be a lot more riders on the bus to make up for. So there's all kinds of assumptions that take place that we just allow. I mean, it's the easiest thing in the world to say something's not possible, or something's too expensive or too difficult. And so I think we just have to question those assumptions.
Senator Harkin has a very funny story of a hearing. And there was a company that he had spoken to that said they could make a bus accessible for $12,000. So there was someone from one of the transit authorities at a hearing who was arguing against accessible buses. And the senator said, "So do you think $12,000 would be too much to make a bus accessible? No, that would be reasonable. But what if I told you there was a company that had the technology to be able to make a bus accessible for $12,000? What would you say? Well, of course, he had to say it would be okay. But I think it's, really looking at transit is so important. As an example, there was this presumption, as Kristen was saying, that people wouldn't use it. There was a letter that was going on in New York saying, people will not use it. This is what it's going to cost. And we should give every disabled person $50,000 so they could get door-to-door transit services. But the taxis weren't accessible. It was just like ridiculous statements. Why wouldn't a disabled person who had access to transportation with curb cuts, etc., maybe not use it all the time, because many people don't use it all the time, but it's something which is important and people want there. But really looking at us, as we've been saying, in a way that presumes we couldn't use, we wouldn't benefit, where would we go? And now what we see after, all these years, 32 years of the ADA and 504, what we are seeing is that the built environment is probably the one area where there have been major changes. Curb cuts, ramps, wider bathrooms, captioning, braille, audio systems, technology, more and more work being done to make technology accessible. And, Bill, I was on a call earlier in California where they have a program now, I believe, at Davis College, which is the first four-year program for students with intellectual disabilities, where they live at the university and have mentors, where what they've been seeing is the deficit, in part, has been the result of students of the system itself having low expectations and therefore not teaching students skills that they need for reading and writing and technology, but how this intensive program, and there are many of them, this one just happens to be the first four-year program, are really seeing dramatic results. And I think this is something that, again, I talk about the healthcare profession and doctors and others for very specific reasons, because so frequently the first people that families will be meeting with are doctors, speech therapists, occupational therapists, physical therapists. If those individuals are devoid of knowledge about what quality education is, what accommodations, I'm sorry, my husband. If there aren't these expectations that families can get from people they look up to, they believe, they don't know what to believe. So you can be talking about, does someone need an augmentative communication device? Does someone need a wheelchair or crutches or mental health services, whatever it might be? But people also need to be able to see that there is a reason and that this will improve people's potential outcomes, and really helping people envision a future that they and their communities may well not envision, in part because of what we've been discussing, the absence of disability in children's books, on television, on Sesame Street, on PBS programs, all these different things where kids are learning, and on and on. So I think, the healthcare field very much needs to be really sincerely looking at not only what it needs to learn from I'm using professional, but I don't mean that. But it also needs to learn about, its role in society, its role with the individual families that they have responsibility for.
Well, let's go a little deeper with this, because there are clinicians among us
I'm
today.
still not saying there are none.
Yeah, no. But, we've got people who are participating in this who are in practice, and some who are in educational programs to become physicians and nurses and nurse practitioners and physician assistants and therapists who do PT and OT and speech, and pharmacists and behavioral health specialists and social workers and many other essential roles. And they're with us today. What would you like them as individual practitioners to know? And at a larger level, what does a welcoming healthcare system look like?
Well, I don't want to tell people only what I think they need to know, because I think people who are in the fields and understand and have a vision of what they want are probably the first people that we need to go and talk to find out what they feel is wrong with the system. And it will be everything from what they're learning or not learning in school to what support they're getting or not getting when they begin practice in the field. This discussion that I was having earlier around education, and this is a program that provides technical assistance to 50 or 60 school districts in California. And, one of the issues that they were discussing, and it applies across the board, is that a student may be coming out of a university where they're learning good skills on, for example, effective approaches to inclusive education. But when they go into the field, if there aren't schools that are following that model, they have nowhere to use their skills. And if they have leadership like superintendents or principals or other teachers who believe this is not valuable, it's a waste of time, then it makes it more difficult for those individuals to be able to take what they learn and in many cases believe is the right way to go. So I think it's very much a discussion between various healthcare providers and the disability community, disabled individuals with various forms of disabilities and family members as appropriate, to really have discussions. For me, what do I see as some of the major gaps? I think we have a totally messed up healthcare system. I think it is so completely disorganized. There is no comprehensive services. You go from A to B to C to D to E to F to G. Nobody, if you don't have someone who is really able to be on top of what's going on, then things are just so uncoordinated. And that has an adverse effect on people, even if they have health care. They have health care, they have access to services. Doctors and healthcare providers frequently don't speak to each other. Certainly, they don't speak to each other with the client in many, many ways. And it's just really kind of appalling to me. And it's just, I think, something that most people agree with and don't disagree, that this is a problem. And don't get me started, but I really feel that it's a danger. I feel like we're potentially spending more money than we should be spending because things are so uncoordinated and we're not getting the benefit that we should be getting. And I think a very other important point is we have failed as healthcare providers to really help the average person understand what good healthcare should look like. And so most people are going about their day-to-day life. They may complain about not being able to get insurance, about how much it costs, all legitimate issues. But they don't have a place where they can turn and say, I want to look at this system in X state or in Y country. What is different about what they're doing? Why are countries like England not complaining about their taxes for national NHS? Because people rely on those services. Do they complain about them? Of course. But, I have friends who live in England, and to me, it's astonishing. I have one good friend whose father was older and had some medical issues and ultimately died. But for a couple of years, when he was sick, he was getting amazing services. They never got a bill. I go to get a sonogram where the person who gives me the sonogram says, I don't know why they said you needed a sonogram, because you had a sonogram 4 years ago and it's not going to change. And it cost me $450 with good health insurance. So I'm not saying anything that I'm sure everybody on this Zoom call isn't aware of. The question is, why are we not doing more to really help educate people? I mean, I think we look at COVID and masking and how people have no idea what public health is. And looking at how do we tell these stories in a way that don't make people feel you're a Democrat or Republican or, three-eyed toad, but that this is based on science. What is science? What is something which is effective and true? How do you, yeah. But I do think it's in the public health arena. I do feel there is much more that needs to be done to speak to the average person, to allow them to be able to think about options based on facts.
Thanks. Yeah. Kristen, thoughts about what we ought to be sharing with healthcare clinicians and those who organize our health systems here?
What is health? I mean, Kristen, I'm interested.
Yeah.
Having grown up in the US and living in New Zealand, how would you compare the healthcare systems? And guys, we've never discussed this. I don't know the answer.
I mean, I think it is. I mean, it was a very distinct feeling to go from a healthcare system, well, especially as a writer. When I left my full-time job and I became a writer and I became dependent on, I had to access health insurance outside of my employment as a freelancer.
In the United States or New Zealand?
As a writer, and so I had just shifted to become a writer, and I left my full-time employment in the US, and I was sort of, created a lot of anxiety worrying about the healthcare system and how insurance would work in the US. And then we moved to New Zealand, and it was like night and day in terms of my level of, I didn't even think about it. I was sort of stunned that my kids just automatically got signed up for dental care at school without me having to do anything other than, sort of just, they sent an email. I said, sure, yes, please give them dental care at school as part of their everyday. I realized I didn't even know when they were having appointments because it happened automatically. Having health insurance covered, just automatically the entire family without having to have full-time employment or going through an employer. That level of, and there isn't also, I think, a benefit of maybe a small country, but the doctors speak to each other here in a different way. I have found they're a lot more connected in terms of handing over patients to each other. Those would be observations.
That's certainly good to know, and that impacts, as we know, services received by people around the world being different. We're going to shift gears a bit and hear from people who have been participating in this externally. And so, Kane, if you have others questions you want to put in. One I want to start with, though, is that we did hear from people who don't themselves identify as people with disabilities, but want to be fellow travelers, want to be allies, want to be supporters, want to participate in supporting disability rights. What advice and perspectives do you have about how people can do this in a knowledgeable and respectful and effective way of partnership?
What's your answer, Bill?
Well,
Is
I
your-
certainly I always start with do things with people, not for people. That advocacy and support is important because as we step forward, we want to know that we're speaking for everybody who believes in universal human rights, and that that when we talk about disability, we're not talking about a narrow interest. We're talking about the heart of people, and that we need to include that in our thinking. So I think anybody who comes to this in an open way is already being an effective partner. But at the same time, use the resources you have to get people to listen. And so I'm wondering what partnerships have been helpful for you and how that's worked. And Kristen, as you've kind of looked at this movement, if you will, what you see about these kinds of coalitions being effective.
Do you want me to go first, or do you want to go?
Oh, me? I'm fine. Well, I think we need to look at disability and the word allyship the same way we look at race and gender and sexual orientation. It is important that we all recognize that we have things to learn. And I think you started out, Bill, I think you used the word with. I think it's very important that people are working with disabled individuals and really recognize the importance of the voices of disabled people playing a prominent role. I also think that coalitions are very important. Coalitions like the Leadership Conference on Civil and Human Rights, which over the last 30, 40 years has been doing more to be inclusive of disability rights organizations as a part of this agenda, and still has ways to go in learning, as we all do, because, you know, the segregation and separation and denial of historic discrimination against pick a group means that we also frequently are denying issues that need to be addressed. You know, what's going on right now with people not wanting discussions on the history of slavery and racism, to me, is so deep and so fundamentally wrong. I mean, as a Jewish person, talking about the Holocaust makes Jews uncomfortable. People being murdered, what's happening in Ukraine. I mean, obviously, that is supposed to make you uncomfortable. It is supposed to make you intellectually look at what happened, why did it happen, what are we doing now to change the course. Not that it's something that young people shouldn't learn about. They should learn about it in an appropriate way. But if we look at Ukraine right now and the amount of visibility and attention it's getting, everybody of every age is really, unless they're being kept away from it, cannot help but look at the tragedy of what's going on. So I agree with what you said, Bill. It's people need to be talking and working together. They need to be willing not to be defensive. They need to be willing to really listen and learn. Look at issues around institutionalization in the past and institutionalization today. You know, what I said earlier, 240, 250,000 people dying in nursing homes and segregated living programs. In reality, we all have something to do with it because we haven't demanded that the government put money into home and community-based services, and to be able to train the people appropriately and pay people appropriate wages and benefits, so that people working in these fields frequently are not able to pull together a meaningful income because they're jumping from place to place. And we are a part of the problem. So for me, what does it mean to be an ally? It means to really want to dig in deeply and look at yourself, look at your family. Everybody's got disabled people in their families. and what are the barriers? Kristen mentioned briefly earlier, that one of the reasons why this work is so important is we want people who do not have disabilities today to recognize that they or loved ones will, without a doubt, have temporary or permanent disabilities. And if you're not doing anything about city planning in your communities, what kinds of housing is being developed? Is it accessible? Is there money to renovate things that you need? What is going on in personal assistance? Who's paying for sign language interpreters? What's being done with information technology and its accessibility? They're very significant issues. Who in the community are working in these areas, and what are they doing to help ensure, for example, when they're designing technology, that the schools are teaching them at the university level what they need to know, so when they go and work for these big companies, the companies don't have to complain that they're not getting people coming into the workforce who are not able to produce what they need. I mean, we really, if you're an ally, you need to look seriously at what you don't know and what you need to know and what you are doing and what more you could be doing with the knowledge that you have today, doing it in conjunction with others.
Kristen, what's your perspective?
I think it's worth noting that the very first person who Judy's parents interacted with about Judy's disability when she had polio was the doctor. And we write about it in the prologue of the book. But basically, he said to them, so you can imagine they were having gone through a traumatic experience of having a daughter who had a severe illness and then had paralysis.
My mother was pregnant with my brother.
Yeah. And immigrants, both of them were orphaned by the Holocaust and had come from Germany at a young age, teenagers. Various contexts going on there. But basically the doctor could have reacted in any number of ways. And what, I think it was the doctor said to them was, I recommend you put her in an institution. And with that simple recommendation, he set a mindset and an approach to Judy's family for how they should. And he has a lot of power. I think we recognize the medical profession and the public health profession have a lot of power, positional power in our society. And so he could have set them on a very different journey if they had been different people, but they actually chose not to listen to his recommendation, and they chose not to put Judy in an institution. And Judy's whole life changed because of it. And actually the world changed because of it, to be honest. And so I think that when people educate themselves, and I think people in the medical profession today and public health profession, they have the opportunity to really educate themselves and figure out how to use that power today, so that they can, both on that micro level of how they talk to every family that's dealing with a potentially new disability, to set their mindset differently. So instead of saying, the doctor could have said, look, this is a collective problem. And what he was saying to them, this is your problem as an individual, family. And so basically, we don't really have an answer to it except to segregate Judy and give her care over it, right? But he could have said, you know what, society, this is a collective problem. It's not the problem of an individual, although our society is not set up for that quite yet. But here's how we think, you can approach it to keep Judy at home, to provide, to access care, et cetera. And so I think that's the first line. And then the second line is, yes, to look at the social determinants of how we collectively deal with disability as a society, and educate yourself about that so that you can help change the system.
I also think there's a real need to both recruit people into the healthcare fields, recognizing that their disability, which may be coupled with many other characteristics, also is very beneficial for the people they're working with, both for families who have a disabled person and for families who don't now have one. But it allows such a more rich discussion, both in the delivery of services and in the people who are sitting around the table deciding the course of what's going to be happening in a hospital, in a classroom, in a university classroom. And, you know, when you talk to healthcare providers with disabilities, they're still disproportionately talking about the biases in the field to address these issues. UCLA is right now doing a complete review of their recruitment for nurses into the nursing school, looking at the biases that exist to make changes so they can recruit, retain, and graduate nurses who have disabilities. These are all things that need to not be happening just here and there. And yeah, another.
Well, those are great comments, and they lead to a couple that we have submitted, and they're really about the next generation of activists, and we're delighted that they are with us and energized. So one is, what advice do you have for individuals just starting their disability rights activism journeys? And then another is a little more specific from an individual talking about a group of students with disabilities setting up a Disabled Students Cultural Center here at the University of Wisconsin. Do you have any words for the next generation of disabled activists? So, to perspectives on the future for those who are in the now and are going to be the ones carrying it forward.
Yeah, I mean, I think it's very important, and I also think it's important to try to do intergenerational work so that people can share experiences. Cultural centers, I think, are very important, especially if they're getting the respect and financing to be able to set up a cultural center that's similar to other cultural centers. For me, one of the values of the cultural centers is also to be able to work across the cultural centers so that there is a real set of discussions going on across communities to help these different communities learn about the biases that exist. But in an important way, you know, when you look at disability studies, which is slowly but surely gaining momentum around the country, disability studies very much needs to be a part of what's going on college campuses, not just in the area of disability, but in other areas. I think, you know, for those of you asking the question, I'm sorry, I can't see you. Obviously, you're already leaders and you're activists. You're doing things and you understand both ways of moving forward, barriers that you have been facing, how you've been overcoming them. And I think it's important, at least for me, it's always important to work with groups because when there's more that, not that, well, usually these issues affect more than one person. And when you're trying, let's talk about universities now, to get universities to make changes, it's frequently something that is easier to do when there are multiple voices that are standing together. I think students doing it is great if they're disabled faculty or other faculty or staff who have disabilities coming together to talk about these issues. I think that's also important because, you know, one thing we're looking at is in many cases, when you look at what is the percentage of disabled staff or disabled faculty on college campuses, the numbers that are reporting are very low. Now, they may really be that low, but I would argue that in many cases, they are not as low as they appear because people are very much afraid of disclosing. They're afraid of tenure track. They're afraid of, you know, not being allowed into a certain program for graduate school, whatever it may be. And I hear it because I speak to students a lot. And obviously, when people talk to me, they are frequently wanting to talk about the problems, but some of the problems are astounding. You know, students talking about faculty calling them out in classes, telling them they shouldn't be in these programs because of their disability, students changing their majors because of what faculty are telling them, even though it makes absolutely no sense. Some students that are really, pushing back against faculty. Like I had this one woman that I spoke to a couple of weeks ago. She, I don't even remember what her disability was, but she's a biology major. And in front of the class, the faculty member, ridiculed her. And she didn't do anything about it because she was, he was a prestigious person on campus. And I said, well, what do you get as a grade? And she said, I got an A and I've been on the dean's list. And I said, well, and he wrote to her because he found out that she was on the dean's list. But did he apologize? He did not apologize. And I said to her, if you're strong enough, at least write him an email. Ideally, go and talk to him and tell him that what he did was wrong and why it was wrong. Now, most people are not going to file a complaint against that person. But this is a group of 5 people that I was speaking to, and 2 of them had problems with faculty. It's just astounding, really.
Yeah.
And I
Bringing
hear
people together for support, always positive, and hopefully with faculty members who themselves have disabilities as a part of that cultural center, not to run it, but to participate in it and to be role models and supports.
But also more, I'm sure, your university has all kinds of diversity groups. The president probably has a diversity group called whatever. And the question is there appropriate representation from the disability community on that council? Are people feeling they're being listened to? The fact that it sounds like there's going to be a cultural center or there is a cultural center is really good, because in some places, the cultural centers in the area of disability have been turned down. So I think it's very promising. And be strong and know, you're going to learn as you move forward. That's both what universities are all about, but it's also, it's like, it's an opportunity to meet and share your views with other people, not just disabled people, and, really learn how to make change. Because then when you leave, if you're a student, you'll continue to take what you've learned and multiply it.
And we have just a few more minutes, but I do want to add a question from Wendy Sun, who's a 4th-year medical student who was part of our planning group here. What do you think will be the next step in disability advocacy, and how can us advocate learners contribute to this movement? And with that, we also received some questions, particularly about digital accessibility as being a next frontier. And I wonder what you might have to say about that and other next frontiers in about 3 or 4 minutes.
Judy, can I just share something very quickly before you answer that? I just want to say, for the students who are organizing, there were some of the top 4 things I learned from Judy about organizing. I'm just going to list them very quickly. One is, a collective problem cannot be solved individually. It has to be solved collectively. Number 2, don't be afraid to make a fuss. You're going to have to make a fuss. That's going to have to happen. Change only happens when you make a fuss. Number 3, do what you have to do to be heard. Interrupt, repeat yourself, take over a building, as Judy did. And number 4, do power analysis of what needs to change, who has the power, who can change it, target those people, build coalitions.
Fabulous. That's important next steps in disability advocacy. Judy?
Give me the question again.
Well, it was, what do you think will be next steps in disability advocacy, and how can advocate learners contribute to this movement? And I do think, as I said, some of that is staying with physical accessibility and sensory accessibility, and also thinking about digital accessibility.
First of all, as I said before, if you're on this call, I don't need to give you an answer. We can have a discussion another time, but there's so many things that need to be done. You know, I kind of defined it years ago and somewhat today. It's like going into a candy store. You've got 50 different pieces of candy you like. You're going to select two, which are the first two, and you make a decision from that. I think in the area of information technology, as an example, and I am not a designer, but really making sure that, for example, your university is accessible with IT, that all the websites are accessible, that students and faculty and staff are able to get the materials they need, and talk to people who understand what accessibility should look like. And I would not be one of those people, but I can tell you what works for me and what doesn't work for me. Look at the areas that are important to you, because again, there's so many areas to address. That pick an area that you want to learn more about, but where you're feeling competent and confident that it's an area you're interested in, and move forward with it. And I think also really reach out to others. I think that's a really critical issue. Get people to tell their stories. For me, you know, one of the important parts of our book was I was rabid about telling stories, quite specifically broken down into fine details, because I feel like it was important for me to be able to look at all this minutia, but it's important for other people to hear about it and to learn about things that you have to deal with on a day-to-day basis. But I also feel that it's very empowering for us as individuals, not just in disability, but to really be able to tell our stories to ourselves, things that bring us joy, things that bring us pain, things that make us angry, things that bring to resolution, and getting other people to be able to tell their authentic stories, I think really goes a long way to helping make changes in the community.
Well, thank you. And we are just so grateful to you, Judy, and to Kristen for amplifying the story that you have told in the work that you have done and the pieces that you've published. And with regret, our time is up. It's been really wonderful. I want to again thank the planning group within the School of Medicine Public Health's Path of Distinction in Public Health, and colleagues in the School of Medicine and Public Health's administration's outstanding communications staff who've been great at making this session happen. I want to thank our ASL interpreters for their important contributions. And of course, to you, Judy and Kristen, and to all who have attended for your attention and your actions, past and future. And I want to close with these words that, Judy and Kristen, you made the last sentence of the book. We, meaning all of us, we are leaders of inclusiveness and community, of love, equity, and justice. Leaders of inclusiveness and community, of love, equity, and justice. Wise words. Thank you.
Thank you, Bill, very much. Thank you, Bill, for leading this discussion.
You're very welcome.
Thank you so
Good
much.
night to all, and good heart to all. Take care. Bye.
Bye. See you again.